Lockdown. Premier Ford says we have to have a lockdown because if we have more cases, the hospitals could reach their capacity. Marc Kealey is a former hospital administrator, joins me right now because I want to understand why, in one of the richest societies in the world, where our hospital administrators and the bureaucracy has known for months and months and months that we're going to have a second wave, why don't we have greater capacity?
Even we're also going to have a third wave. But don't be so hard on the system.
Why don't we have greater capacity?
Don't be so hard on the system. I can tell you this. Right now, I think that the system is building capacity. If you look at what's happening in Burlington at Joe Brand Hospital, they put a tent outside their hospital.
So that's great.
With about 125 COVID-related beds sold.
So they can accommodate it.
So exactly. So
why can't we do it in Peel and Toronto?
Well, I'm in agreement that I think Peel, Toronto, Durham, those places where increases of infections are prevalent, they should be doing the same thing. That's innovation that should be mandated across this province.
So why haven't we been doing that? When the Premier says we have to lock down society because we don't have enough, or we're fearful of not having enough beds, that is not real?
Well, it is real, but when we say
beds, can get more beds.
When we say beds, I think we must be careful because we don't want to give the hospital system an excuse to say we need more money for beds. We have enough beds in this province for the hospital, for the population that we have. What we don't have right now is enough systematization for a COVID virus, and that's what we need to do. So if you look at Joe Brand as a perfect example, that's how you manage during a pandemic, because when it's over, you get rid of it.
Should we have a hospital then that's just for COVID? Or should we make a hospital that's just for COVID?
Well, look, I think this province has done an enormous job of systematizing hospitals in this province. So you have...
Well, how can that be the case when we're locking down everybody, robbing them of their civil liberties because the hospitals can't have the capacity?
I think the hospitals have capacity. We have a pandemic right now, so we have to act accordingly. But I think we don't have to close down every hospital right now and make them a COVID hospital.
Right.
When you have things like patients who need hips and knees have been waiting for a long, long time, or other general surgeries that are being canceled because we don't have ability to do that.
Hips and knees are one thing, but there are people dying of cancer because they haven't had their operations.
Look, there are unintended consequences to this that I think we really have to pay attention to, and I think the system is not working to the advantage that it should be. And this is a great system in this province.
I'm not suggesting that. I know all the health workers are really working their butts off, and the administrators as well, but I mean, should we have some more creativity? Should we be taking patients from downtown Toronto and Peel to other hospitals?
Well, I think
where they have capacity?
I think the creativity or the innovation ought to be there, and it is there if you look at it in the context of how we've systematized. So Durham Region has 5 hospitals. We could be sending patients for elective surgeries to one of those 5 hospitals. The remainder could all be COVID hospitals.
Let's hope they get onto it. Marc Kealey, thanks very much. We'll call that 3 minutes. So thank you for watching, and please make sure that you subscribe and tell your friends. We are going to have lots of fabulous shows coming up in the new year.